Across the world, it is estimated that up to half of the population lack access to essential health services. While there has been significant progress in healthcare, such as the gains made in the treatment of deadly diseases like HIV, malaria, and tuberculosis, huge challenges remain. The COVID-19 pandemic, for example, exposed the need for stronger and more resilient health systems and global health security. And in an increasingly uncertain world, the need couldn't be more urgent.
Global health systems are facing various challenges at the moment, including the impacts brought on by the pandemic, also the impacts of the climate crisis, and the impact of conflicts that are happening all across the world. The Economist has been working with UNOPS on a report that was focused on examining the challenges that low and middle income countries face in building resilient health systems. And a key focus of this report was also on identifying key strategies that can be adopted to foster resilience. So that was really the objective of this report.
So what exactly is health system resilience? And what are some of the ways countries can build resilience into their healthcare services?
Look, there are many definitions of health system resilience, but generally it's really the ability of a system, that could be a complex system, health system, but it could be any other system, to prepare to an unexpected shock, which will have a high impact on that system.
In my mind, there are two things that are critical in making a healthcare system resilient. One is governance and the other one is financing. So one of the things that we try to look at in some of our health system resilience initiatives is how we can pool some of the resources. So for example, looking at the regional procurement policies, where you can pool resources in a particular region or sub-region to bring about better buying capacity to be able to procure medicine and technology. I think that's important. And then making sure that we have the right knowledge and experience for the decision-making body, for the governance.
When it comes to financing, investing in preventative care is a major strategy for fostering resilience. Not only can it result in savings in the long term, it reduces the potential for stresses to occur in the first place.
Resilient healthcare system is a system that takes in many ways a preventative approach, that already before sickness strikes, engages with citizens in ways that lifestyle behavior leads or reduces the risk of sickness, and then of course invests into, for the moment when sickness strikes, into recovery, into treatment that meets the needs of society. In many situations, we know that even universal health coverage is not given at all. So in many situations, thinking about resilient healthcare actually means to, first of all, assure universal healthcare, and of course, at the same time, move beyond it.
It might be useful to think in terms of what are the returns from investments in prevention and in public health, because they're very, very significant. We have done some modeling work, for example, the OECD, that really shows that investments in tackling things like obesity really has a return. It's spending of $1 for returns of up to $6. So it's sixfold returns on the investment that is made. And so perhaps to help, particularly in settings in which resources are scarce, but not only, thinking in terms of those high returns on the investment on prevention might help them making the decisions in the right way.
We need to look at healthcare systems in a more holistic way than sometimes health departments can look at them. It is more than just the healthcare professionals in a hospital, for example. It's about creating the environment that promotes greater resilience in our health in the first place. So making sure that we provide basic needs like clean water and sanitation, healthier lifestyles, which involve, the ability for people to get outside and exercise, to have clean air, and better mental health. All of these things will also help, improve the resilience of the healthcare system.
Another important step towards building a resilient healthcare system is ensuring better access to essential medical facilities and supplies like vaccines for remote communities and the so-called last mile. Investing in mobile infrastructure and digital technologies, for example, can help bring healthcare closer to these communities.
So I'd say there's really three approaches that can be employed generically. One is to put infrastructure close to people, which means a lot of primary care clinics or other kind of first-line clinical settings. Build these facilities in a resilient manner. So in many countries, that would mean things like high ceilings to deal with heat, or put them on high ground to guard against floods. So you want facilities that are both close to people and somewhat resilient in terms of anticipated problems. Bring people who are not close to facilities better connectivity through mobile apps or through other types of technology. Not everybody in every country is going to be, even if you have a massive building program, will be able to walk to a health facility. So you need to give them some degree of connectivity virtually, if possible. And I would add that none of this will matter if there's not a strong and decentralized system of both labs and supply chains, because having facilities without adequate supplies or having facilities without the ability to do basic lab tests is rather meaningless.
Having transparent and sustainable public procurement processes in place is vital. This helps ensure efficiency and the ability to acquire adequate supplies at an affordable cost.
For a health system to function, it requires, first of all, I would say that there are lots of fundamental elements, but one of the ones that apart from human resources that takes a lot of the health budget is the health products that are being bought, the medicines, the medical supplies, the equipment, all the diagnostic tests and all these things that are required to provide the service. And so a lot of the budget available for health is going into the procurement of these commodities. So it's very important that the whole process is transparent. First of all, transparency maximizes competition, which is a good thing because it allows the system to acquire good quality products at the best possible price, and therefore allowing the limited resources that are available to be stretched. And also it minimizes, of course, corruption, which is always a big problem in health procurements.
During the COVID-19 pandemic, we also saw the huge role digital technologies played in response efforts, from enabling governments and health bodies to track the spread of the virus to digital tools like telehealth becoming more widely used.
It's different ways that we can think of when you look at digital technologies. The first thing for me, which is most important, is the data themselves. If you have good health data, which cut across different parts of the health system, are linked across different data sets and are available in real time or very quickly, that is really hugely important for many different things, for government response, the ability to act quickly, particularly in time of crisis, but also for people who work on the healthcare sector, the providers themselves, to optimize their clinical decision making and to make sure that they take the right decision in a safe way for the patient. It's fundamental also for issues like research. Think about the role of data also in accelerating the development of new products, of new vaccines or new testing technologies and supports. So that's the first thing. The second issue is more of technologies in terms of things like the telehealth, which during COVID-19, we have seen a huge accelerations in all countries in ways that were completely unforeseen and unthinkable even before. And it's quite clear that this brings, in a way, the health system into the new century. You know, there are lots of digital innovations which are available. They need to be managed. Of course, there can be some unintended consequences, but they really can make access to care faster and easier, including in remote areas or in areas in which there are shortages of healthcare professionals. So they're really like an opportunity for making sure that we have a much more effective and people-centered also health system.
Looking ahead, it's clear there are many lessons for countries to draw on from COVID-19 that can be used to inform strategies for building healthcare resilience. The challenges health systems face are complex, and governments need to carefully consider where to invest and allocate resources. Thinking more holistically is important, and when it comes to both the delivery of day-to-day essential health services and being ready to respond during an emergency, it could mean the difference in a healthcare system's ability to function well or not at all.